Hello, this is Jim Carp, and I have Don McAnally with me. Don, how are you today?
Doing fantastic, Jim. Good to be with you again.
Yeah, thanks for coming back here. You've got some important information. There's some updates for CARES. Can you share the information with us here?
Certainly, Jim. I want to take this opportunity to help get the word out amongst our client base regarding an important provision really within the CARES Act, and it's the Provider Relief Fund. This fund kind of made the news about last week when monies first started to come out to providers. It was part of $100 billion allotment from the federal government through the CARES Act, and it was under the provider relief section of that bill. And really, it's an all hands on deck approach to help fund providers. Okay, it's been given out. There's been really a lot of noise regarding the stimulus checks that are going to individuals and the triple P loans. And this is an area that kind of flew underneath the radar a little bit, but now it's starting to get some more publicity. We've had just a significant number of clients who have come out and talked to us about it and wondered about it. And we've been advising a lot of them regarding the money. The first round of this is a $30 billion amount that's made available to all facilities that receive Medicare fee-for-service reimbursements from 2019. The second round is going to be a $70 billion funding, and that's going to be a little bit more targeted towards providers who are in COVID-19 outbreak areas and rural providers. Those with a larger share of Medicaid and underinsured providers is probably going to be what the second tranche of this is going to help.
Okay, so then who ended up getting all this then?
Hey, Jim, it was amazing how many different providers got this. Really, this $30 billion was allocated based to any provider who billed Medicare in 2019. So if you billed Medicare and collected money from Medicare, you got a piece of this action right here. So it just didn't go to hospitals. It went to physician providers, also including some practices that you might not think of, OB-GYNs and pediatricians who might be helping some patients with some kidney dialysis type disorders. Durable medical equipment providers receive some of this as well. Physical therapy practices, nursing homes, basically anyone that billed Medicare got a piece of these dollars.
Okay, and then how did they end up receiving it?
Jim, the payments came out. It really started to come out last Friday on April 10th. We started to see some direct deposits. I think the administration has done a really good job of getting these monies out in an expedient type fashion. They began hitting bank accounts last Friday, April 10th, ACH'd into their accounts with the description of HHS stimulus. Okay, so we've been encouraging clients to take a look, getting an understanding of what hits their bank account and making sure that they note something called HHS stimulus. That's the dollars that they received under this program.
Okay, and why did they do this? Why was it necessary?
Jim, a lot of medical practices are struggling right now. I saw a survey this morning from the Medical Group Managers Association that reported 48% of independent private medical practices have laid people off right now. And I think that would surprise a lot of people. I think all the media coverage we've been receiving on the COVID, I think there may be the perception that medical practices are really booming right now. That's really not the case. The main purpose of this thing is obviously to help physician providers, hospitals, healthcare providers with COVID, but it's also to help them make sure that these practices remain viable. In many states, like the state of Michigan, elective surgical cases there's been a moratorium put on them. Okay. And that's many surrounding states as well. So these medical practices are really suffering right now that they're not able to do any sort of elective type cases. We've seen a number of surgery centers, Jim, that are really suffering right now. Also, another thing that's been impacting it is really patient fear that's been driving this whole thing. There's so much misinformation out there, no information out there, and people are afraid to go into emergency clinics. They're afraid to go into urgent care centers and those types of things. So there's a lot of false perceptions out there that physicians are busy when perhaps they're really not.
Hey, Don, just a quick comment. My daughter is a nurse at an emergency room in downtown Chicago, and she said that everything is just completely dropped off, and all they're getting now is the COVID patients or somebody who's really, really sick. So what's ending up happening is people are waiting so long now, their cases are actually getting worse. And again, it's that fear factor of the COVID.
Jim, it's been amazing. A client that I serve is an industrial processor of healthcare linens. And they're an interesting client to talk to see what their orders are for linens.
Mhm.
Typically, in an average week, they'll do upwards of 475,000 pounds of linen. over the last 3 weeks, their orders have been down roughly 50 to 60%. Okay,
Mm.
so I think it's the contrary to what a lot of other people are thinking, that maybe healthcare is just really a booming thing right now. Um, so yeah, it's a really interesting environment right now with what's going on there. So
Sure.
Jim, getting back to why it's necessary, I think that the administration wants to make sure that people out there who become inflicted with COVID, that they don't receive any sort of surprise bills as a result of being inflicted with this disease. The administration is stated with this that they're committed to ensuring that Americans are protected against financial obstacles that might prevent them from getting testing and treatment if they have COVID-19. Okay, so I think they're really doing a good job of helping to open the doors for people to make sure that, hey, if you think you have a problem here, if you think you may have contracted COVID, that you really need to get taken a look at right now. And I think that that's really what they've done here. Now they've worked with some of the payers out there too, to help make sure that payers aren't balance billing patients for this. If a patient is seeking treatment for COVID, the federal government wants to make sure that people aren't using that there isn't a financial obstacle out there for someone to seek treatment. Okay, we certainly can't have people who have COVID that say, I can't get treatment because I can't afford it, and then they end up infecting a number of other people, or worse yet, they lose their lives. It's very important.
Okay, so they're distributing funds that are out there now, and there's got to be some stipulations, catches that are associated with it.
Yeah, Jim, that's a really good question here. I think a lot of clients I talk to, unfortunately, haven't had an opportunity to really dig down into these stimulus monies to gain an understanding with some of the terms and conditions that they really have to adhere to. I think some of them are thinking that it might just be some free money. I was on the phone earlier today with a practice who retired. The physician retired in January of this year. Okay, but because they billed Medicare last year, they received some money this year. Okay. So that's the way the program works. So we had to advise that client to, it's probably a good idea to hold on to that money, because you're probably going to have to remit those dollars back to the federal government at some future date. But there are some terms and conditions that I think physicians and other healthcare providers need to be aware of. First one I mentioned just a little bit earlier ago is that if you accept this money, you agree not to seek collection of out-of-pocket payments from a COVID-19 patient. Okay, so this is what the money's supposed to take care of, is those types of payments. In addition, Jim, you need to sign off on terms and conditions. The Health and Human Services Secretary also sent out some literature regarding some terms and conditions to this money that the recipients need to make sure that they follow, and they're also going to have to testify that they adhere to these. Okay, there are some items in there that are kind of a little bit disconcerting right now, as we really don't know what it all means. This stuff is coming at us so quickly that we don't understand what all these terms and conditions might mean. Some of them are, for example, the first one says that the money goes to people who are currently providing diagnosis, testing, or care for individuals with possible or actual cases of COVID-19.
Hmm.
Seems to make a lot of sense. But Jim, we've had some clients in the dermatology space. We've had clients in the ophthalmology space, in the ambulatory surgery center space. These are clients that are almost effectively shut down right now, and they're receiving some of those dollars. So how are they going to attest to the fact that they treated some patients or possible patients that had COVID-19? We don't know how that's all going to work out. If anyone will even come looking for that at a future date is something that we're going to have to figure out too. Another interesting thing is that the recipient cannot use this payment to reimburse expenses for losses that have been reimbursed from other sources that are obligated to reimburse for. I guess the thing here is what we're concerned about is the Paycheck Protection Program, the Triple P loan, Jim.
Hmm.
How are these monies and the Triple P loan proceeds, how does a medical practice really balance the two in what they're used for? There's a lot of concern about that. We really don't know. Okay. The last one is that there is going to be some sort of reporting. This hasn't been really defined significantly yet, but any practice or any business that received in excess of 150,000, and Jim, there's a lot of practices out there that received over $150,000, must submit a report to the Department of Health and Human Services Secretary and the Pandemic Response Accountability Committee. Okay.
Okay.
So that report's going to need to be something that's prepared probably sometime in the second half of this year, we're going to have to await guidance to figure it out and to see what it takes. Note, Jim, that it's those receiving over 150. I mentioned we've had a lot of clients who've received much more than that. We've also had a lot who've received a lot less than that. What does that mean to those clients in terms of what reporting they have to do? Jim, we really don't know. For this reason, we've taken the tack to advise many clients that maybe they should segregate these funds, put them into a separate bank account, okay? And as the dust settles, as things clear a little bit more, we're able to determine how these funds should really be used, perhaps at a future date.
Hey, Don, you've talked about this up there, but are there other areas that we need to be concerned about from a statutory perspective?
There's some interesting things that are in the bill too, as politics seems to, infiltrate itself into any type of legislative piece, in particular, something that's of this magnitude. There are some provisions within these terms and conditions that limit the amount of the money that can go to executive pay prohibition. So
Okay.
healthcare executives, hospital administrators won't be able to use these monies for compensation.
Okay.
Medical practices won't be able to use these dollars to really compensate highly compensated physicians. Physical therapists won't be able to use it for their own physical therapy practice. They can't use these dollars for any sort of really type legislative type advocacy type things like gun control advocacy. They can't use these funds for abortions, ambiotic research, promoting legalization of controlled substances, or to pay any prior unpaid federal tax obligation. This is some of the fine print within the rules. Jim, you'd be surprised how many times this fine print really comes up and is something that's important to make sure that recipients are aware of in the practices out there. So,
and Don, based on all the stuff that you've talked about here, it makes it all that much more important that you stay in touch with your business advisor to make sure you're on top of this and kind of, in essence, if you're going to get these funds, keep yourself out of future trouble.
Jim, there is so many different things happening. There's so much information coming at all of us on a daily basis, and there's great information and there's misinformation that clients are receiving. And I think the clients put themselves in the best positions to be successful when they take the time and opportunity to reach out to their Raymond consultant and really get the best ideas they can as to how to make sure they take maximum advantage of all the provisions of the CARES Act.
Well, Don, thank you for being proactive and looking into this and getting the information out. If people have questions or comments, best way to reach you.
Wonderful, Jim. They can reach me on my cell, which is 989-751-4065. That'd probably be the best way to get me.
Okay, Don, thanks for keeping us up to date, and we will talk again soon.
Appreciate it, Jim. Thank you.
Take care.